You are listening to the IoT for All Media Network.
Hello, everyone, and welcome to another episode of the IoT for All podcast on the IoT for All Media Network. I'm your host, Ryan Chacon, one of the co-creators of IoT for All. Now, before we jump into this episode, please don't forget to subscribe on your favorite podcast platform or join our newsletter at iotforall.com/newsletter to catch all the newest episodes as soon as they come out. So, without further ado, please enjoy this episode of the IoT for All podcast. Welcome, Dave, to the IoT for All show. Thanks for being here today.
Thank you, Ryan. It's my pleasure.
Yeah, it's great to have you. You want to start off by just giving a quick background, kind of introduction to yourself so our audience gets a little bit more familiar with you?
Yeah, sure. My name is David Minning, and I assumed the CEO role here at Centrac back in April, taking over for Ari Naim, our brilliant founder of Centrac. He and three others started Centrac in 2007 and saw explosive growth in recent years. And I wouldn't say I matched a typical CEO profile of a healthcare technology company after spending the previous 8 years in a private equity portfolio company, a manufacturing company, doing a transformation and resulting in a sale. But I really developed my medical device experience during my 12 years at Hillrom, leading med tech company. I led strategic marketing and product development efforts there. And, the experience at Hillrom truly opened my eyes to the opportunity to improve the operating efficiencies in hospitals, lowering costs through people, process, and technology, and improving the patient experience. It was a really formative career for me and really developed my passion around healthcare. It was a great opportunity for me to join Centrac. My role here at Centrac is obviously to continue that growth that they've seen in the last few years. But equally important is to scale the company and deliver new innovation, either organically or through acquisitions.
That's great. So I'm just curious, how have you seen kind of the pandemic kind of just playing in the market as it relates to what you all do?
Yeah, that's an excellent question. Obviously the most impactful thing about the pandemic, and especially in its early stages, was literally hospitals were not letting any, so-called vendors in. They were basically head down dealing with the crisis in front of them. But what the pandemic did do is it underscored and highlighted some of the inefficiencies. Just at its most basic level, Ryan, how do you get the right equipment at the right time to the right people in an efficient manner? Their capacity was so constrained by their COVID protocols that everything kind of slowed down. And for us, that is just a highlighted need for, our solutions to improve that efficiency, to improve the awareness of where critical devices are to treat their patients. Gotcha.
Okay. And before we dive into that a little bit more, can you give a high level overview of kind of what Centrac's focus is? Obviously, we've already alluded to the healthcare side, the tracking side of hospital equipment, but just, for our audience's sake, what does Centrac do? What role do you all play in IoT, and how does that all fit together?
Yeah, so I guess to keep it real simple and non-technical, you can think of our solution as kind of an indoor GPS systems, primarily for hospitals, which is the majority of our business. 90% of our business is in acute care hospitals. But Centrac has been a leader in RTLS, IoT-based locating, sensing, and security solutions since 2007, as I mentioned. But, we basically began as kind of a device manufacturer, just, creating these really cool sensors. But we've moved into this end-to-end solution, incorporating some of the software solutions that we've acquired. And, what that allows us to do is to offer this full set of integrated solutions to hospitals that are looking at enterprise-wide solutions. And I'll tell you, Ryan, one of the things that is happening, since you mentioned COVID, is a lot of the decision making for these technology investments are starting to happen at the corporate level as some of these hospitals consolidate. So their scrutiny on ROI is just absolutely on steroids, if you will. So you've got to have a really, really proven solution. So we felt that just being only a hardware provider with cool technology and being agnostic was not enough. We have to be really focused on an integrated software solution, as well as the processes that help them, realize their ROI.
Absolutely. Yeah, I think it's a great approach. And on that same note, when it comes to solutions, are there any use cases or kind of applications of your technology that you're able to talk about here, just to kind of connect all the dots and bring it back to like some real world examples?
Sure can. So I guess the most obvious in terms of pure ROI that you can get your head around is asset tracking and asset management, where you're literally tagging all the thousands of assets in a hospital. And what that does is it provides visibility to what's clean, what's in use, what needs to be clean, what's available to the patients, so that they're not overbuying or over renting equipment. So there's a real demonstrative return on investment if you deploy our technology that's really easy to sell, and that's the largest use case that we have here at CenTrak. But then if you take it a little further and more relevant to COVID, our hand hygiene solution, what that does is it enables healthcare leaders to identify system-wide trends and spot irregularities on their compliance. They can use that data to coach their caregivers and boost those compliance rate to keep their patients healthy. And what we've seen in 3 of our facilities, that using CenTrak's hand hygiene solution really boosted their compliance for hand washing by 45%. So it's a real improvement that we can see. So those are just a couple use cases that I think are really relevant to today's time.
Absolutely. Hey, thanks for sharing those. So let's take a step back and talk a little bit more about just IoT's role in healthcare and emerging applications such as contact tracing, and mapping, wayfinding, and those kinds of situations. Can you talk a little bit just high level about how you see IoT playing a role across the board in healthcare, and where you see, in addition to the solutions and the use cases you've already discussed, where you see real big opportunity for IoT to kind of play a role in just the general applications applied to the healthcare space?
Yeah. So, without getting into use case specific and just understanding the data that's available, is, through this data, you can do some analytics, which really leads to some real insights to caregiving. So the more data and the tools that you make available to your hospitals to show what's going on in their facility, the better value they're going to assign to their investment. And what we think our role in IoT is to be able to, either make acquisitions or build the expertise to have those data analytics and provide them in a very user-friendly format, in an actionable format that allows those administrators to improve their operations. And, that can be around assets moving. It can be around patient, flow and patients moving, caregivers, the way they do their business. So all of this data really is valuable. But, again, as a hardware provider, you can't be that expert because you have to rely on other systems and other tools that other companies are providing. We feel we're going to play a really good role as we've made these acquisitions of software and data analytics tools. And we're starting to think about a service that we're going to provide for clinical consulting and providing some insights into these data tools that really will help the hospitals see the value in what CenTrak has to offer.
Absolutely. That's fantastic. One of the things you've mentioned a couple of times throughout this conversation is that the asset tracking piece, location services, and we've heard the term RTLS many times. Can you take our audience through what RTLS actually is, what it means, and the benefits of it, kind of in a little bit more detail than we've already kind of high levelly mentioned here in the hospital setting?
Yeah. So, RTLS is kind of a general term, but what makes CenTrak RTLS unique is this, what we call clinical grade location. And how it does that is we use multiple frequency architecture in our technology. We use, our patented and proprietary infrared based technology, which is called Gen 2 IR. Mm-hmm. So basically, obviously, beams of light that come out of devices, but we also use active and passive RFID, Bluetooth and Wi-Fi, and even ultrasound, because every hospital is different. All hospitals have different architectures and technologies that allow them to locate specifically within, let's say, a 3-meter radius. So that becomes really, really important in certain use cases, obviously, to have that clinical grade. So that's what we feel is unique about us. And what also is really great about, our solution is we have, our data, exist on premise, for the hospitals that have their servers on prem, what they call, but it's also cloud based. So as we move to a cloud base, we can do a lot more remote diagnostics or remote data collection and analytics. So the whole thing ties together. So you start with this great technology, which is, broadly defined as RTLS, real-time locating systems. But really ours is truly differentiated because we use a multi-mode architecture to make sure that precision is paramount to our value proposition.
So I'm curious, as you have worked in probably a number of different hospital settings, what does that environment lend itself to as far as challenges that may come across the implementation of the technology and the solution as you kind of interact with different facilities?
Yeah, I mean, clearly, it's a chaotic environment. There is staff turnover that happens. And so at the essence of the biggest challenge is getting, adoption, training, and engagement. And I use that term engagement purposely because part of the value proposition of our managed services offering that we're going to be releasing next year is actually going to be called Engage. And it's really addressing those challenges that we see of these of the adoption of technologies. I mean, you can probably think of many examples, Ryan, where there's technologies that are built, bought either in your own personal life or businesses that just get there's a high excitement level, but they get underutilized because either the supplier doesn't make it a great consumer experience, if you will, or there just weren't the resources deployed to adequately train and retrain. So that's what we're going to be focused on. So that headwind to success is really what we're front and center trying to deal with as a company so that we can continue to grow. Because if I can say, we're kind of at this crossing the chasm moment at Centrac where obviously the early adopters bought it. There's been some, rapid growth, but wide scale adoption has yet to occur. We're only penetrated in just over 1,000 hospitals. So we think there's a lot of runway left to really get this thing widespread.
So as we kind of connect the dots from what we've been talking about on the healthcare, the RTLS side as it relates to IoT, and then also the pandemic, I'm curious to just get a sense of how IoT and RTLS have been helping healthcare facilities address the pandemic specifically, rather than just the high level benefits of RTLS and in the healthcare space, but specifically as we connected to COVID and the pandemic that's happening now, what have been the benefits of being able to utilize that technology in that setting?
So, I mean, obviously at the core of contact tracing is knowing location. So, the pandemic being, 9 months into this thing, I don't think I can readily rattle off like, okay, hospital X has really, utilized, RTLS to solve this issue that for even using it for contact tracing. But the recent inquiries, now that the hospitals have been able to take a breath, now they're starting to say, hey, we muddled our way through this. Right. We're going to be better prepared next time because there will be a next time. And that's the things that's happening most. So the conversation around asset tracking and caregiver efficiency is being subordinated by, hey, we need better visibility to infected patients who they're coming in contact with. We need better hand hygiene compliance because obviously that's at the core of spreading infections. So the conversation has shifted to more of an infection prevention conversation versus an asset management. So, I can't give you specific examples yet, but I'm just telling you the conversations I'm having with hospitals are that.
Yeah. Okay. Makes a lot of sense. I'd be curious, like maybe later on next year, have you come back and just tell us a little bit more in detail when you can share those details. I think it'd be really exciting.
Mm-hmm.
So if we have listeners out there kind of getting a sense of not only what you all do, but how this all applies to the healthcare space, I'm sure there's a lot of listeners who are very interested in kind of exploring this. What advice do you have for organizations or individuals out there looking to kind of work with an IoT vendor with more of a single source solution? Like, what are the advantages of doing that? What should they be kind of thinking about as they're engaging with a brand like yours? And what does that usually look like from your end?
Well, I think, the term single source is appropriate because you want, one neck to choke if something goes wrong. But I think it's important for me to mention that, even though we have proprietary technology and we have a suite of software solutions now, we remain an open architecture platform. So, whatever the best of breed, for example, software solution that a hospital is used to and they want to use for example, asset tracking, they can use that. We don't preclude the customer choice at all, but we do promote the value of having kind of a one-stop shop if that's what the customer feels they want. So before we relied on total reliance on partners and other software vendors. Now we can actually offer something and give the customer a choice. And I think that's going to be important because, honestly, with technology deployments in hospitals, it is a maze of confusion and chaos when you're trying to, integrate with your EMR, your hospital HRIS system, all these different platforms they have. It becomes an integrated, nightmare trying to project manage. So we like to pride ourselves on having a really solid project manager who's kind of taking the headache away from hospitals. So to the extent that we can do that better and almost consumerize RTLS, if you like that term, make it simple, then that's what we're going to focus on. And I think that would be the advice I would say is find the vendor that makes it the easiest, to do business with.
And I would say one of the ways that you would make it easier is by understanding all the different potential technologies that can play into the implementation of a solution to provide not just the ROI for the customer, but also a successful launch and deployment of the solution to achieve their goals. So when it comes to having the choice of multiple technologies like, Bluetooth, Wi-Fi, infrared, you name it, to match to a certain facility, to a certain use case, to help kind of balance that, precision and affordability. How do you all go about selecting the correct technology? And, I guess, could you also explain to our audience the benefit of working with a technology partner to provide those recommendations on technology use and why that's so important?
Yeah, I mean, knowing what infrastructure you're dealing with, but before I specifically answer that question, I think I'd given in terms of an example, we have just released a product called TrueView, and TrueView was specifically targeted for senior care market, where obviously the cost is more of an issue in that segment, and they don't have the sophisticated IT infrastructure. So it was really built around focusing on their existing Wi-Fi technology, incorporating some plug and play BLE technology to get you location-based accuracy, but at a much more affordable price for those facilities that can't afford the millions of dollars for deployment. And senior care is perfect for that. We're also looking at that solution for our international expansion because, as you know, price points in international markets are much lower than in the United States, and they're not going to be able to afford as much. So being able to flex down on the architecture in terms of matching what's available to them without significant additional investment on their part for architecture is really key to cover all those price point continuums.
Yeah, that's great. We found that with not most listeners, but most companies, that are looking to adopt IoT solutions, the decision on the technology part is very overwhelming. There's a lot of different components. They just don't know where to start, right? So we've seen great success when an organization is very knowledgeable about the different technologies available to the particular use case and can not only help them choose the right one, but also educate them on as to why certain technologies are not the right fit that they may have read about and think are the right fit. And there are just a lot of different pieces to that puzzle that is, often a roadblock that stops companies from even going down the IoT adoption path. And I think the more companies that are knowledgeable about that and can share that expertise, the better we're going to be as an industry as a whole.
Yeah, we have great partners that help us out in doing some of this, I'll call pre-assessment before you make the recommendation. You're gathering the information from the customer, understanding their needs, and really matching the solution. We pride ourselves in not trying to jam our customers with the technology solution without really fully assessing. And when we rely on partners to do that, and we've got some excellent partners that are out there helping us in this journey, because we're still relatively small, but sizable enough to service the big hospital clients. And we rely on our partners to do a lot of that upfront legwork. And that's one of the key initiatives that, I'm going to be driving is how do we develop an even better partner network, maybe fewer, but better and more qualified, that are more consultative and more engaged with that hospital client base.
Yeah, IoT is viewed very heavily as a partner-centric ecosystem, and too many companies, in my opinion, just go all in on the partner side, where they just get as many partners as they physically possibly can to show that, hey, we have a deep partner network. But in reality, I think it's more about choosing the correct partners to complement what it is that you as an organization is doing at the core and where your core expertise lies. And I think oftentimes that's not the approach, and it creates a lot of confusion for customers who are looking to pick the right vendor to work with.
There is no question that was the approach of Centrac in the early days, is, sign up the partners, put it on your website, here's the criteria. But we've gotten mature enough to say, look, we want the best of breed on our partner base. And maybe there's ultimately going to be, just 10 to 15 instead of, 200. We think that's the right place to go.
Yeah, I totally agree with you. One of the last questions I wanted to ask you before we wrap up here is just regarding other challenges that we may not have alluded to or talked about yet in this discussion that you've come across through the development of the technology, through the deployment of certain applications and solutions. What are some challenges that maybe listeners out there would not think about as they kind of start their IoT journey that you guys have encountered enough to learn best practices on how to navigate around and avoid? And just your general advice for kind of approaching that process.
I would say humbly that is a work in process on our part. And One of the challenges that we have, Ryan, is, technology is changing so much when you talk about, Cisco versus Aruba and all the different platforms out there, and moving from on-prem to a cloud-based solution. Things are happening so fast that our biggest challenge is being able to prioritize on all those platforms, because, just like every other company, whether you're manufacturing, food products or you're manufacturing technology, you have to have a new product development roadmap, and you have to make trade-offs. So understanding where the trends are going, the big trend, has been, BLE. It's the Bluetooth technology. Do we need to be on top of that? How do you make that assessment? How do you make your bets on the next technology? So one of the things I want to do, Ryan, is I want to make sure that if we as a technology company are going to get disrupted, we do it ourselves. We have to disrupt ourselves. I know that's pretty cliche these days. But, we have some really, really talented people that have given the opportunity to be segregated and think about how do we put Centrac out of business. We're going to do that because it's best for the customer. It's best for our future of our business. So my advice to any company in this space or any other technology space is do your best to try to disrupt yourself and don't be afraid of it.
Yeah, I was actually, as you were saying to disrupt yourself, I was thinking in my head, basically to put yourself out of business, and then you said it. And it's something that I've heard before. And like you said, it can come off very cliche, but if you take the other approach and you actually do it, and you don't, it's not, just words to sound like, what you're talking about and try to sound encouraging. If you actually try to put yourself out of business and disrupt your own technologies, I think it's a very great path to true disruption in the market and to create a real competitive advantage for not only yourselves, but your customers. And I think it's something that's important and a lot of organizations just talk about, but don't actually do. So if you're able to actually do that, that's fantastic.
Yeah. And that's why I was so excited to take this role, because this is going to be a lot of fun doing that.
Yeah, absolutely. So the last thing I want to ask you before we finish here is just your thoughts on kind of we're ending 2020 going into 2021. What are you expecting to see or hoping to see happen in the IoT space, in the healthcare space, the RTLS space? Like what are you kind of predicting is going to be happening next year, or looking forward to happening next year that we should be on the lookout for?
Well, I think from a market standpoint, I think there's pent up demand that's happening. Once, as I mentioned earlier, once the hospitals are able to take a breath, assess, and do their postmortems on what they experienced during this crisis, they're going to really scrutinize their investments in technology. And I think the winners are going to be those that make it simple, make it the ROI clear, and make the implementation process seamless and less confusing. So to the extent, as we talked about, just kind of as a summary, when you get full engagement of the hospital personnel on your solution, you train, you retrain, you provide data insights through great analytics. I think that's going to be the future. It's not going to be as much as the technology, as much as the analytics and insights that you're going to be providing to your customer base.
Yeah, I think that's going to be a big separator, because the technology is going to, it is getting to a point where it's not, I don't want to say run of the mill, but it's very well positioned for particular use cases. Now, what can you actually do with it? And can you produce those analytics and that data to make it worth the venture for these organizations? And whoever does that the best, I think is going to be in a really good spot to win. So I'm very much in line with that thinking. Last thing, anything exciting, interesting kind of coming out of the Centrac side of things going or now or next year that we should kind of let our audience know about or keep an eye out for? And then at the same time, if they have any questions or any follow-up, what's the best way to engage with you all?
So I would say keep an eye on our next release, which is going to be our Wayfinding mobile app.
Okay.
Believe it or not, there's millions of dollars wasted for patients missing appointments, trying to navigate these complex campuses, sprawling campuses. So a mobile wayfinding app is going to be released by Centrac very soon. Obviously, to learn more about our solutions overall, we have a great website, been updated with our new leadership team, our new mission. We're excited about some of the new releases coming out for our solutions. And certainly, as we become more of a managed services organization, you can be assured that we're going to put the full force of great people behind the investments that our customers make.
That's fantastic. Well, David, it's been great talking to you. Appreciate you sharing some insights into what you all are doing. We'll make sure that we link up Centrac website, contact form, all that kind of good stuff, so that our audience can engage with you all going forward. And again, I really appreciate your time. Your insights are fantastic. And hopefully next year we'll be able to have you back to talk a little bit more about what you have going on, and some of those things you could allude to, but not necessarily talk about in detail. It would be great to kind of hear insights into what you've been learning and how you're seeing things develop.
Ryan, it's been my pleasure, and be safe.
Thank you. You too.
Take care.
All right, everyone. Thanks again for joining us this week on the IoT for All podcast. I hope you enjoyed this episode. And if you did, please leave us a rating or review, and be sure to subscribe to our podcast on whichever platform you're listening to us on. Also, if you have a guest you'd like to see on the show, please drop us a note at ryan@iotforall.com, and we'll do everything we can to get them as a featured guest. Other than that, thanks again for listening, and we'll see you next time.